Tabassum Dalla. She is consultant obstetrician gynecologist, director at Jubesta Hospital, Raipur. Currently, she is vice president, Raipur Menopause Society, and she was our previous president, Raipur Obstetric Gynec Society, joint secretary, chapter, and she has won many awards, women empowerment.
Thank you, ma'am. Everyone knows
she's
me.
very dear to all of us. Yeah, thank you.
A warm welcome to our own conference, EZCON IMS, and being the opening batsman, my regards to everyone, and I hope you enjoy your stay in Raipur. So the first visible thing which we see in our body is our face. So the first wrinkle which is seen, first sign of menopause which is seen is also on the face. So the menopause phase, beyond wrinkles. But I would like to stress upon things what every gynecologist should know. Menopause affects not only vasomotor symptoms and bones, but also the face, the most visible marker of estrogen deficiency. So what does the face, why does the face change? Estrogen decline causes reduced collagen, reduced elastin, it reduced hyaluronic acid, sebum is reduced, and skin thickness is also reduced. So there is thinning of skin here. Nearly 30% of skin collagen is lost during the first 5 years after menopause, followed by 2% every year. So we can see here, this is a young skin on the left side, and there is on the right side, there is one estrogen deficient skin on the left and the estrogen positive on the right. We can see a very good structured collagen there. That yellow pillars are there. A very good pillar will keep this room well. But if the pillars are shattered or reduced, then the skin starts sagging. That is how the estrogen maintains the elasticity of the skin. So what changes? Dry skin happens, fine wrinkles start coming, and the cheeks become hollow. As we can see, our beautiful Angelina Jolie, without fillers, without anything, she'll look like this. She'll have hollow cheeks, deep nasolabial folds, jowls, and look at the lips. They are thin lips, and pigmentation starts coming. So that is how a beautiful Angelina Jolie becomes a beautiful menopausal Angelina Jolie. What is the science behind it? 3 levels of age simultaneously happen. First, the uppermost part, the skin, then the fat compartments, and then the last, the facial bones, all those also start reducing. Estrogen deficiency accelerates all these three things, skin, fat, and bones. So how does estrogen affect hair follicle? Estrogen is also like a pillar, and it is giving strength and support to each and every hair follicle. If the estrogen is depleted, then what happens? The hair starts becoming thinner. What happens to the skin during menopause? Dryness happens, reduced elasticity, increased fragility, and the wound healing is also delayed. And the texture, it becomes rough. What are the bone changes? Maxillary resorption, mandibular remodeling. Whatever cream you apply, whatever cosmetic procedure initially you do, we cannot change the bones remodeling. Orbital widening happens, and this causes impact on the facial support. The bone is giving us the support, which is getting reduced day by day. Then what happens? There is redistribution of fat, descent of malar fat pads, hollow cheeks, nasolabial fold deepens, jowl appears. So this is how things happen. See at those eyebrows which have become thin. How do we assess it? History, age at menopause, any hormonal therapy, smoking, sun exposure, and weight fluctuations should also be asked for. In clinical examination, we should assess the skin quality, volume loss, bone support, how much it is, dynamic wrinkles should be seen, what all are the dynamic wrinkles, and hair evaluation should be done. Lifestyle measures are important. Smoking cessation, sleep optimization, exercise, protein intake, stress reduction. The newer girls who are smoking nowadays, when they become menopausal, they'll become menopausal early. So nutrition does help. You have to reduce the protein intake, omega-3 fatty acids, either in food or in supplements. Vitamin C, zinc, antioxidants should be included in diet, and if it is not possible, then by supplements. Can hormone therapy help? What are the evidences? Hormonal therapy may improve skin hydration. It will improve the elasticity. The dermal thickness can be increased. Collagen synthesis will be better, but it is very important. It does not replace cosmetic procedures or reverse advanced structural aging. What can be corrected by what? So, what is the problem? If the problem is dynamic wrinkles, like if I'm smiling and these wrinkles are coming, then what will help? Botulinum toxin. If there is volume loss, then hyaluronic acid fillers would help. If there is laxity of skin, HIFU, RF would help. If there is a textural problem, then fractional CO2 laser. And if there are fine wrinkles, then we start with retinoid creams. So everything has its own needs. It's not that we have to give everything to everyone. So what are the future directions? What are the emerging therapies? Biostimulators and very famous plasma-rich platelet poor plasmas, platelet plasma, PRPs, very famous exosomes, which are still experimental stage, regenerative aesthetics can be done. Now, what is the role of a gynecologist here? We have to recognize their concerns. Not every woman has got problem with everything. They are okay with so many things. If they have got some problem with, let's say, fine wrinkles, then we have to treat the fine wrinkles. That's how we have to recognize. Then optimize. Menopausal hormonal therapy only when indicated. Nutrition, protein intake, sun protection, and smoking cessation. Smoking cessation should also be a passive smoking cessation. Refer appropriately to dermatology, plastic surgery whenever it is needed. So, what are the take home messages? We all know menopause accelerates facial aging. Estrogen loss affects skin, fat, and bones. Menopause hormone therapy improves skin quality but is not an anti aging treatment minded. Lifestyle, skincare, and aesthetic interventions complement medical management. So, everything is complementary. Gynecologists should counsel, set realistic expectations. We cannot say that you would be like a 16-year-old again, and refer when appropriate. So thank you so much for a patient listening.
Thank you, Dr. Tabassum.
Thank you, ma'am, for your excellent presentation. Menopause phase reflects more than aging, and which overall reflects the health and the hormonal changes. You very well reflected in your presentation. As a gynecologist, we must also recognize the need of the patient, the concerns, and we must also tell them about the lifestyle changes. So your presentation was very nice and concise, ma'am. Thank you for your presentation.
Thank you.
Now I will call the second capsule 2 speaker, Dr. Aditi Singh, for the topic filler benefits, risk and patient.